My name is Dr. Daniel Fahim. I'm a neurosurgeon with Michigan Head and Spine Institute. Unfortunately, as patients, we're sometimes limited by what our doctors know how to do and what they don't know how to do. Sometimes people who treat the spine are only familiar with the more traditional open operations and not familiar with minimally invasive spine surgery. But that's a very important option to be educated about and to be aware of when deciding whether or not to receive treatment for your spine disease. So it's important to seek out a surgeon who's familiar with both open treatments and minimally invasive spine treatments. Essentially, everyone who has a problem with their spine is a candidate for minimally invasive spine surgery. There are very few occasions in which open traditional surgery on the spine is required and minimally invasive spine surgery would not be a good option. Just as a general brief overview of the difference between traditional open surgery on the spine and minimally invasive spine surgery, I just want to describe these differences to you. Traditional open surgery on the spine involves making a midline incision and dissecting all of the muscles and ligaments off of the spine in both directions, removing a significant amount of the bony structure and bony support of the spine in order to reach the area of pathology. That can frequently result in a lot of blood loss, a lot of pain, a lot of discomfort, and prolonged postoperative recovery by the patient. It can also possibly predispose the patient to something called adjacent level disease or adjacent segment disease, where they begin to have problems higher up or lower down from where their operation was. With minimally invasive spine surgery, we're able to make a paramedian incision, which is an incision off the midline, and use a small tube to dock right on the area of abnormality or pathology, right where the disease is, and use slightly larger tubes on top of that smaller tube to get exactly where we need to get on the spine, where that problem is happening, and then use a microscope to look down to the bottom of that tube and address the area of pathology. The advantage there is that you leave all the other structures of the spine intact. All the ligaments, all the muscles, all the bony structure that doesn't need to be touched is left alone. And that helps patients recover faster, have less blood loss, have a shorter postoperative stay, have a quicker recovery, and feel a lot better after surgery. So if you're dealing with a problem in your spine, it's important that you speak to a spine surgeon who's not only familiar with traditional open operations, but also familiar and able to perform the full spectrum of minimally invasive spine operations as well.